Hello folks, Dr. Ken Gilman here. Parnate panic. We get all sorts of inquiries, and I thought I'd deal with this one quickly because it's interesting and it's like so many aspects of these MAOI drugs, it's a fertile source of misunderstanding and changing treatment without good reason. So I'm calling it parnate panic, but the real message is don't panic. There's a little story to illustrate this one. It's about the way parnate affects blood pressure, and this particular instance that's precipitated this little video is an inquiry about an unfortunate lady who finished up in the ER because I suspect an hour or two after taking her parnate, her blood pressure went up to 200 over 110 or something like that. And everybody got in a bit of a panic. The first thing to say about blood pressure is anxiety and a whole lot of other similar stimuli that we encounter many days of our lives are responsible for fluctuations of blood pressure. When you're relaxed and sleepy, your blood pressure is lower, and when you're busy and excited, it's much higher. That is perfectly natural. If it didn't happen, it would be unnatural. If a saber-toothed tiger leaps out from behind the rocks and roars at you, you run like hell and you experience a fight and flight reaction, during which your blood pressure will increase to 220, 250 even. Most people who do vigorous exercise like triathlons and marathons and heavy gym exercise, they'll be running a blood pressure of 200 to 220 most of the time they're doing that. So it's really important to understand that major fluctuations of blood pressure are a normal reaction to the demands, physical and emotional, that our bodies experience. Now, with MAOIs, perhaps more with parnate tranylcypromine than with phenelzine, Nardil, you do tend to get what we call post-dose hypertension, 1 to 2 hours after especially a larger dose of parnate, and that often means after the second dose of the day, if people are taking it morning and lunchtime, as we usually recommend they do, they will experience a modest increase in blood pressure. In a great majority of people, that's asymptomatic. They don't notice it, and doctors aren't usually around to measure their blood pressure at that time. So historically, that phenomenon was very much under-recognized. Now, of course, when we've got lots of people who've got the clever little electronic blood pressure machines, which are pretty good nowadays, they give pretty accurate measurements. More people measure their blood pressure, and we encourage everybody who's on drugs like MAOIs to measure their own blood pressure regularly with one of these devices, because it's a very valuable piece of information about the dosage and whether it's too high or not high enough, etc. And now more people are measuring their blood pressure. It's becoming apparent that a greater proportion of people than previously thought do in fact get this transient rise in blood pressure an hour or two after the dose. And it doesn't matter, it's not important. Occasionally, like in this lady, it goes high enough to cause symptoms, as it does in other situations in life. The little story I'm going to tell you in a moment or two. So it's nothing to worry about. If, as in this case, it caused this lady headache and so on and so on, and got the doctors in the ER room a bit excited, then it's easy enough to stop that happening with a dose of a beta blocker, particularly propranolol. That's the drug of choice to prevent that happening. So what you do is you take, sometimes quite a small dose is enough, like 20 milligrams. Some people need 40, 80, and occasionally even more. The dosage of drugs like propranolol varies quite a lot from person to person, so it is important to experiment with the dose a little bit. But often 20 to 40 is sufficient. And the duration of action of propranolol is sufficient that one dose in the morning will cover the morning and the lunchtime dose, and you don't need any more than that. But people who take it for other reasons take it twice a day. And it can be taken either regularly if you're getting a lot of that sort of trouble, or just on a one-off basis. Sometimes people's propensity to get that effect is present at the beginning of treatment and then goes away. This particular lady, and I haven't got a detailed report of exactly what happened, but it doesn't matter. This is the sort of thing that happens. This particular case, it appears to have had an onset out of the blue, so to speak, when she'd been taking the same dose for quite a long time and not had that trouble before. That, of course, raises the possibility that it, in fact, isn't related to the parnate, that it was to do with anxiety. Obviously, I don't know enough about it in this particular case to say anything about that, but it's important to realise that that can be the case. I'm searching for a reference to bolster this story that I was just talking about, because this is an appropriate point in the talk to introduce this. Anxiety and other emotions can definitely produce very large increases in blood pressure. And the quick story I wanted to tell you is about Alfred Russel Wallace, who was the co-author of the first ever paper on evolution presented at the Linnean Society in 1870, whatever, and Darwin, the theory of evolution. Everybody's forgotten that Wallace was a co-author of that paper. He was a fascinating fellow. In that age, lots of people went on collecting trips, sending specimens back to collectors and museums in Europe. And hundreds of thousands of specimens were sent back. Wallace was an early explorer of the Amazon and sent many specimens back from there. That's how he earned his living. Unlike Darwin, who was a gentleman scholar of substantial private means, he was just an ordinary chap who didn't have any money to back him up, so he was dependent on his earnings from his collecting. Well, he came to this area, the islands around Indonesia and the Spice Islands and everything else, and he gave a wonderful account of his first capture of the Cairns birdwing butterfly, which some people have described as the most beautiful butterfly in the world. I saw one this morning in our garden. We've planted the poisonous vine. I've written about this elsewhere. That's the host for the necessary, obligate host for the caterpillars. And if you go in our garden, you can see lots of these caterpillars and their pupae. Well, not caterpillars at this time of year. They're very pretty caterpillars. They're huge chocolate brown caterpillars with a big orange thing that sticks out of their head if you poke them. It's called the osmetrium, and that's poisonous too. But they collect the poison from the vines, and they sequester it, and adult butterflies secrete it into their wings, and that protects them from attack by birds. And it's so poisonous, this aristolochic acid poison, that a bird only has to come near them and it detects it and shies away. So it's an extraordinarily beautiful butterfly, very large. I think it's the largest butterfly in the world, about 7 inches across. And Wallace describes how, when he first captured this butterfly, his emotional reaction to it was greater, and I'll try to quote his words more or less exactly, than I had ever experienced previously, even when in apprehension of immediate death. And that, of course, tells you the dangers he encountered in his explorations all over the world in these remote and dangerous places. And he then goes on to say that his heart pounded furiously and he developed a headache, and he had to go back to his tent and lie in his tent for the rest of the day, feeling overwhelmed and exhausted with this pounding heart and headache. And that, of course, is a wonderful example and description of the fight and flight reaction and how pronounced it can be. And I suppose many people in modern life don't often encounter that kind of experience, and we forget that a real fight and flight mechanism, when you really do believe that you're facing destruction and death, is an extreme reaction that leads to a massive flood of adrenaline in the system, exactly as you can get with a tyramine reaction if you eat a lot of tyramine-rich food. That's essentially doing exactly the same thing of producing a sudden release of large amounts of adrenaline into the system. And I'll add here something that I think is really quite important. One of the reasons we can be confident that this is not something to worry about, because doctors, and I'm sure they transmit this worry to a lot of patients, say that, oh dear, if your blood pressure goes up like that, your head can explode. You know, you get a subarachnoid hemorrhage or something. Essentially, that isn't true. If it really was true that there was a danger of something like that happening when you get a severe reaction like that, then of course most of our ancestors would have dropped dead, because in the days of primitive man, those kinds of stimuli were almost an everyday occurrence, I should think. So evolution would have soon selected out in a major way any members of the species whose head exploded when their blood pressure went up like that. So I think that's the simple, decisive reason why we can say that that's not going to happen. Except, there are always exceptions, aren't there? And of course, a proportion of people who suffer from subarachnoid hemorrhages suffer from them because they've got either a congenital or an acquired abnormality of the blood vessels in the brain, which make them particularly delicate and susceptible. And eventually, at some stage in their life, they might burst, and that might occur during an episode of elevated blood pressure, whatever the reason for the elevation of the blood pressure might be. And that is usually nothing to do with drugs or anything else. It's just to do with everyday life. But lots of people who actually have a subarachnoid hemorrhage do not appear to have been engaged in any kind of activity or circumstance which would be expected to raise their blood pressure before the subarachnoid occurred. So sometimes it just kind of happens. So that's a slight aside that puts things in perspective. So these reactions of an excessive elevation of blood pressure after, as I said before, usually 1 to 2 hours after the dose, and usually after a larger dose, which is often the second dose of the day, do occur, and they're nothing to worry about. If symptomatically they require treatment, propranolol is the answer, and just adjust the dose to get the appropriate effect. But there's certainly no need to panic and no need to stop the medication. Now, depending on the circumstances, it might be, let's take this hypothetical case of this lady who had been on it for quite a long time, and obviously was doing very well and didn't want to stop it because she'd had, as is so common with the people who talk to us about the MAOIs, they've had shed loads of treatment before that have been to no avail, and then within a short time of starting Parnate or Nardil or whatever, they've got a tremendous improvement. So obviously they're very eager not to have the medication stopped, and that is entirely understandable, isn't it? So, I've forgotten what I was saying. This happens as you get older. Oh yes, so dosage adjustment. So in that case, where she's been on it for a long time, maybe the dose is higher than it needs to be, and a cautious and slow downward adjustment of the dose might be appropriate, or spreading the dose out a little bit more sometimes can help. It can be a bit tedious to take one tablet at a time in 4 different doses spread out a couple of hours apart, but some people manage that quite well and others don't. Or lowering the dose. So either adjusting the dosage schedule or lowering the dose can sometimes be helpful, but propranolol is the treatment of choice. Another quick word about that. Other beta blockers are not necessarily the best thing, and in this particular situation, propranolol is the preferred drug. So don't let some doctor who thinks he's being clever give you a different beta blocker. There's a long and detailed explanation about that on my website. That there's a couple of thousand words or more about this complex business of how these drugs affect blood pressure and how propranolol helps sometimes also with the postural hypotension, the low blood pressure that's a necessary part of the action of these drugs to a greater or lesser extent. But that's a separate subject.